Good afternoon and welcome to Ask the Experts. We're bringing you all the answers to your questions live right here on Facebook. It is Head and Neck Cancer Awareness Week this week, so we've brought in Dr. Caitlin McMullen with us. She is one of the oncologists in our Head and Neck Cancer program, and you guys have a free screening coming up this week.
We do. Thank you, Sarah. I'm so glad to be here today. Thank you for having me. We're really excited. This week is Head and Neck Cancer Awareness Week. So all across the country, places that take care of head and neck cancer patients, hospitals, doctors' offices, are hosting free screenings, including us here at Moffitt. So we're going to have a screening event on Friday right here in our clinic upstairs on the first floor at the main Moffitt building. It's a half a day, so last year we got through almost 100 people. We have a whole team of our doctors there, plus our nurses, advanced practitioners, including PAs and nurse practitioners, all helping to screen patients for head and neck cancer. So we're really excited.
That's awesome. So if you have a question for Dr. McMullen today, we do want to hear from you. She'll be here to answer your questions. All you have to do is post your question in the comment box below, and we'll get those questions out to her. Now keep in mind, Dr. McMullen cannot offer any type of personal information or diagnosis over Facebook. If you have a specific question like that, you can call 1-888-MOFFIT or go online to moffitt.org. So I think we should start out by kind of explaining what types of head and neck cancers are and what body parts do they affect. A lot of people may not know that.
Sure, yeah, that's a great question. Even my friends and family still don't know what exactly I do. Head and neck cancers typically involve the lining of the mouth, the throat, the voice box, squamous cell carcinoma, which is a cancer of the mucus lining of the mouth. We also treat cancers of the saliva glands, so you have major saliva glands on the side of your face and under your chin, and you also have small ones inside your mouth. So those areas can also develop cancer. So we typically treat those with surgery, radiation, and chemotherapy. I am particularly a surgeon, so that's my role in taking care of these patients.
What does that, if people do show up to that screening, what will it involve? They may be a little nervous. Is it invasive? Is it easy? What will you guys actually do if they come to that
We'll make
screening?
it really easy and comfortable for you, I promise. Generally asking some questions, understanding your risk factors for head and neck cancer, if you have any symptoms that might be concerning for head and neck cancer, and a physical exam, which would involve palpation, meaning feeling the neck, feeling for any lumps, looking inside your mouth, usually with a light or a tongue blade, those popsicle sticks. And we also use dental mirrors to help look around inside your mouth. So nothing invasive, just looking inside your mouth and feeling the neck for any lumps or abnormal areas.
Awesome. So we do have a question from Donna on Facebook. She says that I've been a smoker for the last 10 years. Does that put me at a higher risk for cancer?
Yes, Donna, that puts you at a higher risk of multiple types of cancer, including head and neck cancers. So smoking is a very serious risk factor for oral cancers and throat cancers, including the voice box and the upper throat. We strongly suggest that you quit, and we know how hard it is to quit. Here at Moffitt, we actually have a smoking cessation program that we take advantage of a lot. They're excellent and have great resources that are even free for patients. One of the biggest things that we recommend are nicotine replacement therapies, so patches, gums, they're quite safe and effective. And the most important thing is to not stop trying. So don't quit quitting. Keep trying. Most people who successfully quit have tried many times before.
We have another smoking-related question. This one is from Frederick. He says, I smoked for 14 years. He doesn't smoke anymore, but I've never had a checkup. So what should I be aware of and what should I be looking for?
That's a great question. Well, it's always good to see your doctor on a regular basis for routine checkup if you're a smoker or not. So that's always a good idea, and especially if any particular concerns or new symptoms that aren't going away. Some of the things that we look out for as a warning sign for head and neck cancers are a number of things. Lumps in the neck, lumps above the clavicle bone here, sores or ulcers inside the mouth that don't go away, difficulty swallowing that doesn't go away, sore throats, ear pain, bleeding areas that just continue to bleed and don't get better, and nosebleeds that don't continue to get better as well. So all those things are normal parts of colds, or you bite your tongue, but if those things don't go away, you definitely should get them checked out by your doctor.
Again, if you do have a question for Dr. McMullen, you can post it in the comment section below, and we will answer that question for you live here on Facebook. We're just talking about smoking as a risk factor. Are there any other type of risk factors that people should know about when it comes to head and neck cancers?
Sure, yes. There are a lot of important things to know about as potential risk factors for head and neck cancer. So not only smoking, but heavy alcohol use. So, occasional glass of wine or a drink here and there is not going to put you at significantly increased risk of head and neck cancer. But heavy alcohol use, and often in combination with smoking, those two things can act synergistically to increase your risk of cancers.
Go ahead.
No, it's okay.
So we have another question. This one is from Joey. How old should I be to get screened?
That's a very good question. So, there's no formal regular screening that is recommended as an age-based recommendation when you see your family physician. So anybody who's an adult should see their family physician about once a year for a routine physical. Our screening event can be anyone who's an adult, so from the age of 18 up to the age of 105, you're welcome to come in and be screened by us.
One of our Facebook followers, Sarah, sent in this question. How is HPV related to head and neck cancers, and what's the best way to protect yourself against it?
That's a really great question. So the HPV, or the human papillomavirus, is a risk factor for throat cancer. So it's increasingly common that certain throat cancers are caused by the HPV virus. Traditionally, these were caused mostly by smoking, but as the rates of smoking are declining now, we still see persistently elevated rates of certain types of throat cancers, and we find that it's actually related to this virus. Over half of new cases of throat cancers are caused by this virus. And by throat cancers, I mean specifically what we call oropharyngeal cancers. So the oropharynx involves the tonsils, the back of the tongue, and the back wall of the throat. So the HPV virus puts you at risk for cancers in those areas. Now, prevention is a great question. There's now a great vaccine available to prevent the strains of HPV that can cause cancer. Most humans are actually exposed to the virus during their life, so there's not much you can do in terms of your daily life to prevent contraction other than the vaccine, because we all are potentially exposed to the virus, but some people clear it, and unfortunately some people develop cancers, and we still haven't figured out why certain people get the cancers and some don't.
Can you touch on maybe things that you should be making sure your primary care physician's kind of looking at, or the dentist is something I think that might be important, since there's no screening age that we were talking about earlier?
Yeah, that's a great question. Yeah, so routine checkups with your regular physician and your dentist, all very important. Things that they should be looking out for are feeling your neck to make sure there's no abnormal lumps or masses, and looking inside your mouth to make sure that there are no sores or ulcers there, and that your tonsils, if you have tonsils still, are equal in size.
Again, if you do have a question for Dr. McMullen, you can post that in the comments section below, and we'll get you an answer as soon as possible. Heather wants to know, what are some of the treatment options if you are diagnosed with head and neck cancer?
That's a really great question as well, and a lot of it depends on what type of head and neck cancer. As I said before, the head and neck cancer is kind of involves a lot of different areas and a lot of different types of cancer, so what it really needs is an evaluation by a specialist to determine what the best treatment for you is and for your particular type of head and neck cancer. But in general, there are three main treatments for head and neck cancers: surgery, radiation, and chemotherapy. Sometimes those are given in combination. But what it really needs is an expert evaluation by somebody who treats these regularly, who can determine what the best treatment is for you.
What about recurrence in head and neck cancers? Is there a higher rate or lower rate than other cancers? Is that something that's been seen?
Well, certain types of head and neck cancers are quite serious. If they're caught earlier, in earlier stages, it's obviously better for reducing the risk of having them come back. But they certainly do come back, similar to other types of cancer. Actually, cancers that are caused by the HPV virus have a better outcome than the traditional types of head and neck cancers caused by smoking and alcohol use. So while there are more people developing cancers because of the HPV virus, they actually have a better outcome, and their stages are often lower than those who present with smoking-related throat cancers.
We have another question that just came in. Jessica wants to know, is the dentist visit sufficient as screening for head and neck cancer?
Dentist visits should be acceptable for checking your mouth and throat for any kind of abnormal lesions or cancerous areas. If you have issues with your throat lower down, the dentist can't really look back there, so first starting with your family doctor or seeing an ear, nose, and throat doctor would be great if you're having issues with your throat. But if there's an area in your mouth you're concerned about, the dentist is an excellent resource for checking that out.
Obviously, the weather is getting warmer and summertime is here. What about being out in the sun a lot and UV rays and everything like that? I know a lot of us probably don't lather sunscreen as much as we probably should.
Yep, sunscreen is very important. Skin cancers can occur in the head and neck, in particular the ears, the tip of the nose are very high risk for developing skin cancers, the lips as well. So always wear sunscreen when you're out in the sun. Not just sunscreen, but wearing hats and being under umbrella whenever you possibly can. If you see an area that won't go away or won't heal, a red area, a scaly area, it bleeds, or a lump somewhere, definitely get those checked out right away. They could be signs of cancer.
We've seen, a lot of advancements and a lot of other, in cancers in the last, decade or so. Is there anything, I guess, big that's happened with head and neck cancers, in the last decade or so that's really helped with the diagnosis and treatment?
That's a great question. The discovery of the HPV virus has been really interesting and revolutionary for us in head and neck cancer care. These patients have particular genetics to their tumor and respond to certain treatments very well. So that's been really interesting for us. And of course, the vaccine that's now available for that is going to really change the landscape of head and neck cancers a few decades from now. I know it. There are new drugs for advanced and metastatic head and neck cancers called immunotherapy medications, and we have experts in that here at Moffitt in our head and neck cancer department. They aren't appropriate for everybody, but certain patients who have advanced head and neck cancer, they may be an option for them.
Looks like Joe wants to know, does a healthy diet help me at all when it comes to prevention for head and neck cancers?
A healthy, balanced diet is always important for preventing all type of cancer, including head and neck cancer.
Awesome. Any other advice that you think our viewers need to know when it comes to head and neck cancer?
Importantly, if there's something that's not normal, make sure you get it checked out. If there's something that's not going away, you have trouble swallowing, you don't feel there's something right in your mouth, definitely get it checked out right away. And you have a lot of resources. The dentist we've already talked about as a great resource, your family doctor, and ear, nose, and throat, and even coming in to see us here at Moffitt if you have any concerning areas.
We just have another question coming in. It says, my husband's going for a biopsy in the morning for a mass on the back of his tongue with infiltration of level 1 and level 2 lymph nodes. He has had referred ear pain and throat pain for the past 2 or 3 months. He's never smoked, dipped, and drinks occasionally. What should he expect from the biopsy?
Well, I'm sorry to hear that you're going through that. That's going to be really, it's going to be a difficult time for you, and I'm sorry for that, but I expect you're going to do great with treatment. Those biopsies are actually usually pretty quick. Obviously, I'm not your doctor, and I don't know exactly what to expect for you and what exactly is going on without seeing you, but typically what those biopsies involve are going completely to sleep, going to the operating room, usually doesn't take more than an hour, and doing some biopsies from the back of the throat and seeing exactly where the tumor is and what exactly is going on. Usually they're not too painful, which is good, and you go home the same day. Again, that's just knowing in general what's going on. I don't know exactly what's going on with you. But
are biopsies a typical kind of first step for a lot of patients that come in that may have something
certainly.
there?
Yeah, well, first step is obviously a physical exam. Having your doctor look around your mouth and your throat to see if there's anything unusual. And if a mass is found, a biopsy is definitely an appropriate first step.
Awesome. We have another question coming in, and I think this refers to they have DES cervical cancer with lymph node penetration. What type of treatment is appropriate for this? I'm not sure that's a head and neck.
I'm not familiar with that. Cervical cancer are often related to HPV virus as well, but it's not my area of expertise. I'm sorry.
Our GYN department as well. Do you get a lot of people that come in for treatment who really never even thought of head and neck cancers? I feel like, colonoscopies and, colon cancer and other breast cancer is so well known. Do you think people aren't thinking about, head and neck cancer as much and the preventative aspects of that?
Yeah, it's a pretty rare cancer. Most people have met somebody who's had breast cancer or prostate cancer, but they may have never even heard of head and neck cancer. So when they're diagnosed, it can be very surprising. Especially for patients who have HPV-related cancers. Often they have very few symptoms, and they're very surprised to find out they have cancer. They're not smokers, they live healthy lives, they don't understand how this happened, and it's really hard to deal with, but usually they get through the treatment pretty well.
If someone cannot come to the event on Friday, they just found out about, they can't get out of work, what should they do? Can they go somewhere else, or how can they get checked out?
Of course. Well, you can always call us here at Moffitt if there's something you're concerned about and want to get it checked out. Your family physician or a local ear, nose, and throat or a dentist, as we talked about, are excellent resources and a good place to start if there's something you're worried about.
Awesome. So again, we have that graphic up for you guys, our head and neck cancer screening. It is free at the main Magnolia campus here at Moffitt at the Head and Neck Clinic, which is on the first floor. If you park by the Gold Valet, you'll find it right around the corner there. Again, that's Friday, April 13th from 8 a.m. to 12 p.m. Don't be scared away by the Friday the 13th.
Don't.
They will, Dr. McMullen and the rest of the program will take very, very, very good care of you. If you guys come, tell your friends and family members. It's going to be, I think, a great opportunity for you guys to show what Moffitt's all about. Prevention is such a big part of what we do here.
Mm-hmm. We're really excited. We've got the whole team mobilized. We've got some snacks. We've got lots of pamphlets and reading material for people. And we're really excited. We hope a lot of people come out and get screened.
Okay. Well, thank you for taking the time to answer the questions. I hope you guys on Facebook got some of your questions answered and know a little bit more about head and neck cancer for the Awareness Week. So thank you, Dr. McMullen.
Thank you, and thanks for watching.